Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Mackie, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Happy to have you along with us as well. Members of the media, you're reminded, if you'd like to submit your questions for our panel today, to use the question forum here on Microsoft Teams. Just click on the text bubble with the question mark in it, and when you do submit those questions, if you could indicate your name as well as your media outlet, and also who your question is for. I will start off by saying we only have a few questions in the queue to get us started, so don't wait to ask your questions. Let's get those in as quickly as we can in today's briefing. And finally, a welcome to those who are tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, those who are listening on Global News Radio 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. I'd like to congratulate London's own Maggie McNeil for winning Olympic gold in the women's 100-meter butterfly event. Maggie's a Banting Secondary School grad and former member of the London Aquatic Club. Maggie and our great Canadian Olympians have trained through COVID and without the usual international meets to hone their skills. So it is exceptional that this is actually Maggie's second medal of the Games and Canada's first gold. So congrats, Maggie, to all the athletes from the London area competing in Tokyo. You make us so very proud. And where COVID is concerned, generally speaking, the news remains highly encouraging. We had only a handful of cases across the weekend, just 3 reported today. Almost all, though, of those reported not fully vaccinated, or for the most part, not vaccinated at all. Across Ontario on the vaccination front, we now have more than 80% of the population age 12 and up with 1 dose and nearly 67% with 2. What we're seeing, though, is the number of vaccinations being administered on a daily basis starting to slow, perhaps not as much here in Little Middlesex, not yet anyway, but certainly across Ontario. So look, we know there's an extremely small and incredibly vocal minority who will refuse to be vaccinated no matter what. They're tone deaf when it comes to protecting their loved ones. I guess so be it. We also know that yet there's a large group of people out there who are just hesitant, have not received even a first shot to this point, yet will wind up doing so. That's the group I'm trying to reach, those with ears to hear. That's the group we're working with. Reaching them is so important. It's the time to get vaccinated. It's now. The Delta variant, it's serious and highly transmissible. For those who are unvaccinated, it's literally only a matter of time before the virus catches you. It's not the same COVID we were dealing with last summer, not even close. Look, a vaccination rate of 80% is great. That still leaves 1 in 5 Londoners exceptionally vulnerable. A 4th wave in the fall or winter here will be the pandemic of the unvaccinated. But that doesn't mean those who have been vaccinated won't be impacted, quite the opposite. Those who get sick with COVID will place a significant strain on our shared healthcare system. They'll run the risk of producing new variants, and even with a vaccine with the potential of rampant spread comes the risk of breakthrough infections. My message to those on the fence, just do it. Just walk into a vax clinic today, get the shot. 28 days later, get your second. That's it. No more delays. For you, no more COVID. Look, the life you save may be your own. Maybe your mom, maybe your brother's. But this is something that's totally within your hands to do. And we highly, highly ask you, encourage you, beg you to do it. Over to you, Warden Cathy.
Great. Well, thanks very much for that, Mayor Ed. And what a great way to start a week, with waking up and finding out that a gold medal has been earned and won by a local Londoner. And so on behalf of the residents in Middlesex County and my colleagues, certainly we pass along our congratulations to Maggie. What a great accomplishment. And it's so great to be able to celebrate something instead of focusing on all the negative. And certainly certainly the pandemic has caused us to look at and at times focus on what has been lost, all that has been taken from us. However, during the last, 16, 17 months, there have been positives. In the early days, we really learned to appreciate our essential frontline workers. We, although we've often talked about it, about a work-life balance, the pandemic forced us to live our lives with a work-life balance. And for many of us, that was difficult. And it was something that we thought we couldn't do. The other big positive was, of course, the focus on supporting local and what that means. Keeping our small businesses going became a priority. Choosing to support an in-person retailer or a restaurant through takeout became a concentrated effort. I ask you to continue to do that. We live in southwestern Ontario, and now is the best time to live here. We are so fortunate to be surrounded by agricultural land. Communities throughout Middlesex and organizations in London host local farmers markets featuring all of the local produce and meat that this area has to offer. In the early days of the pandemic, there was a lot of talk and concern about where our food is coming from. So I encourage you to learn about what local foods you can bring to your table. Fresh produce, fruit, dairy, meat. Supporting a local farm has the same ripple effect for our economy as supporting a small business. So if you are experiencing a staycation, make sure that you add a visit to a local market to your itinerary. And to echo what the mayor said about vaccinations, I spoke about this last week. The options available to getting a vaccine are so incredibly accessible right now, whether it's a walk-in clinic through the health unit or a pop-up clinic that's coming to your community. You don't need an appointment, you can just show up. If you know somebody that is close to you, family or a friend, that hasn't gotten their first shot or is now hesitant because of media stories out there about getting their second shot, I would ask you to sit down with them and have a conversation with them. Don't belittle them, don't berate them. That's not going to get you anywhere. But have a conversation to explain why getting the vaccine is the best tool to get us completely out of this pandemic. Over to you, Dr. Mackie.
Thank you very much, Madam Warden and Mr. Mayor. We had a tremendous couple of days over the weekend, just 5 cases reported Friday and 3 Saturday. These are the sorts of numbers that I think we can feel good about. Unfortunately, the longer term trend is not as clear. We're definitely seeing cases, higher than we would like. And this is one of the rare moments when our percent positivity here is slightly above the provincial average. So as a community, we definitely need to continue to double down. Still, the vast majority of cases are among people who are not vaccinated. The vaccine campaign has slowed down as well, matching the provincial rates. We knew this would happen. We knew the mass immunization clinics were the right tool to reach as many people as quickly as possible, but they're not the right tool for everybody. And so that's why you're seeing a wholesale shift across our vaccine campaign, where we're expanding the mobile clinics. 8,000 vaccines through our mobile clinics since June 25th. We have about a dozen mobile clinics coming up in the next little while. I do want to flag a couple of the mobile clinics because they're important for certain subgroups. On Thursday, the 29th this week, we have a mobile clinic at École Secondaire Catholique Monsieur Bruyère. That'll be from 1:30 p.m. to 6:30 p.m. That's an important clinic because it is a French language clinic. It is listed on our health unit pop-up vaccination clinic's website as Thursday, the 29th of July, 1:30 p.m. to 6:30 p.m. at Monseigneur Bruyère. We also have a clinic on Friday. This is not a pop-up walk-in clinic. It is specific for Indigenous youth, and that's being held at Namarand in the afternoon as well. That is, again, only for Indigenous youth, and we're really hoping to get the message out so we can get as many as Indigenous youth vaccinated on Friday at Namarind as we can. There are lots of other clinics popping up, both health unit clinics and in partnership with Middlesex-London Paramedic Service over the next 2 weeks or so. They are across London and Middlesex, so please do get onto the healthunit.com website and find those. And again, all of those pop-up clinics are now walk-in. In fact, all of the mass clinics as well, walk-in for first doses, second doses, whatever you need, we've got it at those clinics. Dan, I'm going to pause there and hand to Dr. Dukelow.
Thanks very much, Dr. Mackie, Mr. Mayor, and Madam Warden. Appreciate the opportunity to be here today and provide an update on COVID-19 at London Health Sciences Centre. We are continuing to see the trend of lower COVID-19 related hospitalizations, which we are thankful for. As of this morning, we are caring for 6 COVID positive inpatients, with 5 or fewer of those patients in critical care. While our hospitalized numbers continue to be a positive sign, the sobering reality is the COVID-19 virus is still active and impacting our community, as highlighted by Dr. Mackie. We are unfortunately reporting today that a COVID-19 outbreak has been called this afternoon on our B7-200 adult mental health and psychiatric intensive care unit at Victoria Hospital. Currently, the outbreak involves fewer than 5 total cases, and our standard enhanced outbreak measures have been put into place. Based on our experience in recent months, we're confident that our outbreak protocols do work to contain these outbreaks and are hopeful that we'll see an end to this with swift resolution. While COVID cases have declined over the past few weeks, the amount of non-COVID care we are providing has continued to increase. Our emergency department volumes are now above pre-COVID levels, resulting in increased wait times and more admissions to hospital and pressures on our inpatient units. Our emergency departments and inpatient areas are also working with less beds than we had pre-COVID because of the precautions that are necessary in place to prevent outbreaks and spread of infection. As of this morning at 7 a.m., our overall hospital occupancy is 90.8%. It is our goal to maintain our occupancy at right around 90% over the next few weeks and months to ensure that we have enough capacity to respond to the pandemic while also caring for the non-COVID-19 care needs of our community. Lastly, as we are now into the second week in step 3 of Ontario's reopening, I would like to remind everyone to continue to follow public health measures to reduce the spread of COVID-19. Also, I would like to remind everyone to enjoy your summer activities safely. Certainly, having worked last weekend in our emergency department at Victoria Hospital, we were seeing a number of accidents or injuries that could have been prevented. So whether you're swimming, boating, or riding an ATV, please stay safe. Thank you again for attending today, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Mackie, Madam Warden Burghardt-Jesson, and Mayor Holder. Okay, well, we do have some questions, and again, a reminder, if you are joining us as a member of the media and you have questions, maybe you've had questions prompted by the opening remarks today, please do click on the text bubble with the question mark in it to submit your questions, again, indicating who your question is for. Let's go to the questions right away that we have. And this first one is from Jane Sims at the London Free Press. It's for Dr. Dukelow and Dr. Mackie. So if one or either of you can raise your hand, and we'll go with whomever would like to answer this first. Could you give us an update on vaccination rates across healthcare workers in the region? I understand that LHSC has a self-reporting system, but I'm wondering if there are any new efforts in place to get healthcare workers to take their shots or report their vaccination status. Are you in favor of mandatory shots for healthcare workers?
I'm happy to comment, and I'm interested in Dr. Dukelow's comments as well. We don't have great data, as I think we've talked about here before. The rate of vaccination is really through self-reporting, and we know that there are lots of folks who, for whatever reason, haven't reported their vaccinations yet. As an example, if you look at Middlesex-London Health Unit staff, of our permanent full-time staff, we know that at least 89% have been vaccinated, and over 70% have had 2 doses. That's permanent full-time staff. If you go down to our casual staff, and our head count has increased from 300 people a year and a half ago to 900 people now, over 900 staff. Those casual temporary folks that might do a shift here or there, they're not combing through every health unit email to see those reminders about getting their vaccines reported. So our rate, if you look at that overall group, is more like 60% first dose and 40% second dose. We know it's higher than that. We know it's really a reporting issue, and we don't have, a great way to get that data. We are looking closely at whether we change our policies internally. We're not at the point of mandatory vaccination, but mandatory reporting might be our next step. And working with our staff internally, unions, et cetera, on what that would look like in a way that respects the autonomy and independence of our staff. Again, we don't have great data. There are some long-term care and other facilities that have been able to track very closely what their staff rates have been and have seen good uptake of vaccination, but it's really not a perfect system from a data perspective.
Thanks. I'll pick up on where Dr. Mackie left off, and certainly my comments would be very similar to his around working through the process as we speak and trying to get our rates up and struggling with self-reporting. So our self-reported rate at LHSC, remembering we have close to 15,000 staff and physicians, the self-reporting rate is about 70% right now. And we'll be following the direction of the province in mandating vaccinations for staff and physicians if that does happen. Because we're part of a broader health system, like Dr. Mackie mentioned, we can't make those decisions in isolation, and we have to take into account our unions, our people, privacy legislation, and a variety of other items. So for now, we continue to focus on encouragement and education through campaigns like our Get Vax campaign. A few weeks ago, we launched an online learning module through our iLearn platform, and which is mandatory to do that module. And within that, staff have to either test to be vaccinated or do some short education on the vaccine. So lots of efforts. And lastly, we have an on-site vaccination clinics at our hospitals happening on a weekly basis now to make it more convenient for people. So hopefully we get those rates up to or close to 100% in the coming weeks.
Thank you, Dr. Dukelow. Dr. Mackie, I think you have an added comment there.
Yeah, just to answer the second part of the question, yes, I'm absolutely in favor of mandating, with appropriate exceptions, people that have medical exemptions, or there has to be an outlet for folks that really have a philosophical or religious reason not to get vaccinated. But, the same way we have secondhand smoking legislation, wherever you are indoors in proximity with others, you can't smoke. You put other people at risk. And so, as a society, if we want to see this pandemic truly end, if we want to see everyone be safe, including people who are vaccinated but high risk for various reasons, and if we want to get our vaccination rate from 80 up to 90%, we absolutely need mandatory vaccines, not just for healthcare, but other places where people would be putting others at risk, including schools, post-secondary, and other facilities. You saw the huge success in France when France introduced vaccine passports requirements for entering into restaurants. You saw 2 million people sign up within the 2 days after that announcement. That's exactly the sort of policy that will get us over that 80% threshold, up to 90%, where we can really put this pandemic to bed.
Thank you both, Dr. Mackie and Dr. Dukelow. Let's go to the next question. It's a follow-up from Jane Sims. Dr. Mackie, can you give some advice to people who have unvaccinated people in their lives? What's the best approach to getting the vaccine hesitant crowd to take their shots? And we heard some comments from the mayor in his opening remarks about, and also from the warden, just to talk to some of those people. What's your advice?
Yeah, I mean, the personal stories and the personal reasons, getting into an argument about the merits of vaccines and the various sources of information versus, the misinformation that is circulating on social media and elsewhere is not helpful. What is helpful is talking about your reasons why you did it. And that can make a difference for some people. It's really difficult. It's really difficult. I think that there's an inherent part of human nature where a subgroup of our population is always going to resist doing what the mainstream does whether it's because of resisting authority or just wanting to be different. And that's something that has been present with vaccination since the beginning of time. We will not get to everyone. We do want to create environments where it's easy to get the vaccine, where there are good reasons to get the vaccine, whether they are safety of self, safety of others, or accessing services. Putting those sorts of incentives and those policy regimes in place will make a big difference. At the end of the day, we know that it won't be 100% of people that get the shot.
Thank you very much. Let's go to our next question, and it's a final one from Jane Sims. Dr. Mackie, do you have any concerns about the planned reopening of Canadian borders next week to American visitors?
Well, so the big issue is really about mandatory vaccines. So the fact that you've got the heavy incentive on people crossing the border to be doubly vaxxed and in order to avoid quarantine, that makes a big difference, and it means that the people that are coming from the US will be well protected. And it obviously highlights the importance of Canadian Border Services tracking those who are not vaccinated and making absolutely sure that they are quarantined. If we're not able to do that, then we definitely are going to see a risk with cross-border travel. But if it is vaccinated folks that are coming across the border, I'm not concerned.
Our next question comes from Craig Needles at Blackburn News this afternoon. Dr. Mackie, you previously said we're in a fourth wave for the unvaccinated. We've seen case counts across the province hold steady at levels slightly higher than what we saw last summer. Are you becoming concerned about the potential fallout this September for the community, regardless of vaccination status?
Yeah, I think that is the timing that we're looking at. First of all, we'll see what happens. If we go to a full open on August 6th with gathering limits in the thousands, then we really could see a wave much sooner than the fall. If that doesn't happen and we're able to get vaccination rates up, then there's no doubt we will see more activity in the regular flu/coronavirus season. Again, coronavirus is a seasonal virus. It has been for the many years that we've been tracking other types of coronaviruses. And when winter conditions hit, you see more spread. That will happen this year as well. The question is, how big will that wave be? And I think that is really the question about the fallout, is how high can we get the vaccination rate? How big will the gathering limits be? Do we continue to have masking indoors, for example? If we get rid of masking mandates altogether indoors, then again, you're going to see something like Delta variant that's highly contagious spread very quickly through some of these gatherings. You've seen this in the European countries that have opened up to even places like the Netherlands, where you saw and Denmark, where you had club sort of environments, music festivals that opened to anyone who was vaccinated with no masking, no distancing, etc. Raging outbreaks through mega events with hundreds, in some cases over 1,000 people becoming infected at one of these events. So the vaccine is very effective, but it's not 100% effective. And if we go too far in the direction of gathering unmasked, even with vaccination in place, we're going to see major waves in the fall.
Thank you very much, Dr. Mackie. The next question comes once again from Jane Sims at the London Free Press. Dr. Dukelow, it's for you. Dr. Dukelow, about the outbreak on the one LHSC floor, does it involve patients, staff, or both?
Thanks for the question, Jane. It involves both patients and staff.
Thank you very much. Colin Butler joins us from CBC London. Dr. Mackie, you mentioned Indigenous youth and Francophones as some of the subgroups you're trying to target for vaccinations. What are some of the other examples?
Sure thing, Dan. Just correcting a technical issue on this end. We had a battery running out on this laptop. So other groups, we've worked with all cultural groups that are interested. We have last week with the Black London Network, we had a clinic that was supporting the Black community in partnership with Black London Network. We had over 200 people at that clinic. And actually, that was a great clinic because almost 30% of the people there were first dose. So that's great to see vaccines into new arms. We worked in the Hindu temple last week as well. That was the second dose. We've been to that facility earlier. We've been to the London Muslim Mosque. We're working again with whatever groups are interested. We've done lots of work with the Indigenous community. Wherever there is a population that is experiencing lower vaccination rates and community leaders that are willing to work with us, we will do those pop-up mobile clinics to meet the needs of the people that they work with.
And you mentioned working with those organizations, Dr. Mackie, is a follow-up question from Colin Butler. Why is it so important to target specific communities in this way?
I mean, there are a few reasons. First of all, we're seeing lower vaccination rates in some of these populations. If you look at in Indigenous, it's been slightly lower, but Black population in particular, you've seen less vaccination uptake. But when you work with those communities, you can see great uptake just like any other group. So meeting the needs. And then we know there are various barriers, whether it's language barriers, cultural barriers, or even just comfort with a clinical environment. When we can go into a community facility like the London Muslim Mosque, where people are familiar, they trust the leadership, they connect with the facility and the organization, then it gives a link that the health unit doesn't necessarily have in our regular operations. And those links can make the difference between somebody saying that they are too busy and saying instead that they are ready to get the shot.
Thank you very much, Dr. Mackie. And that does bring us to the end of our questions that have been submitted from our media partners this afternoon. I'd like to take the opportunity to thank Dr. Mackie, Dr. Dukelow, the Warden of Middlesex County, Cathy Burghardt-Jesson, and London Mayor Ed Holder for joining us for this afternoon's virtual media briefing. That will do it for today. We will be back with our next virtual media briefing. That is coming up on the 28th of July, which is it's the 29th, the Thursday, the 29th. We will join you, we will hopefully have you join us for our next virtual media briefing, Thursday at 2 p.m. And a reminder, with the civic holiday weekend, we will not be having a virtual media briefing next Monday, but we'll instead have it on Tuesday. So that's it for us today. Thank you again for joining us. We hope you have a great rest of your Monday afternoon. We'll see you on Thursday, and so long for now.